Microbiota as predictor of mortality in allogeneic hematopoietic cells transplantation. Definition: hematopoietic cell transplantation is a critical treatment of patients with high-risk hematopoietic malignancies, hematological deficiencies, and other immune diseases. Applications in medicine. Substitute the patient hematopoiesis has it is insufficient totally or partially detective or neoplastic. Allow the administration of the intense anti-neoplastic treatment with very high doses of chemotherapy or radiotherapy. TCPH is truly as a rescue remedy that counteracts severe myelosuppression and its life-threatening from cancer treatment.
High-dose chemotherapy followed by an autologous stem cell transplant using your own stem cells is an important treatment option for younger and/or fitter myeloma patients. Although high-dose chemotherapy is very effective in destroying myeloma cells, it also destroys the normal healthy stem cells in your bone marrow. A stem cell transplant is therefore necessary to rescue and restore the bone marrow. The process involves a number of different stages and begins with induction treatment that lasts on average between 4 to 6 months. The next stage involves the collection of your stem cells. Stem cells are collected from blood, but to be able to collect enough for a transplant, you will be given treatment to mobilize the stem cells from your bone marrow into your blood. This consists of injections of the growth factor G-CSF, and sometimes also an injection of cyclophosphamide. These drugs increase the number of stem cells in your bone marrow, causing them to spill over into the blood, where they can be collected easily. If you are having difficulty mobilizing stem cells, you may be given another drug called plerixafor. Stem cells are collected or harvested by a process called apheresis, in which blood is taken from one arm and passed through a cell sorting machine. This separates out the stem cells, and the remaining blood is returned into a vein in your other arm. The harvested stem cells are mixed with a preservative and then frozen in liquid nitrogen until the time of your transplant. The next stage involves treatment with high-dose chemotherapy. This is usually a high dose of melphalan given intravenously, with the aim of removing any residual myeloma cells you have following induction treatment. However, as mentioned before, the melphalan can also destroy normal healthy cells. Your previously collected stem cells are reinfused back into your blood, where they make their way back into the bone marrow. The transplanted stem cells then begin to make new blood cells. This vital process, which effectively rescues your bone marrow, is known as engraftment. The first sign of engraftment is a rise in your white blood count. This normally happens 2 to 3 weeks after the transplant. Until the new cells engraft, you are at high risk of infection because you have fewer white blood cells. It is important that steps are taken to protect you from infection and to treat you as soon as possible if you develop one.
Pros and cons. Pros. The biggest advantage of allogeneic transplant are the absences of cells grafted malignant, the potential effect in anti-cancer immune, possibility to try malignant and non-malignant disease including an immunological. Cons. Among the disadvantages of allogeneic transplantation include the difficulty of finding a donor HLA compatible appropriate and the possibility of develop a syndrome after transplant known as graft versus disease guest, which contributes to the morbidity and mortality of the procedure.
When we talk about stem cell transplant, what we're typically referring to is transplantation of the bone marrow. The bone marrow is an organ, just like your heart or your skin is an organ. The bone marrow is the organ that produces the blood, and the blood then circulates throughout the body. When a disease like leukemia hits a child, it resides in the bone marrow. And so in order to cure that disease, we have to give the child very, very high doses of chemotherapy and radiation to kill and eradicate all those cancer cells. And then we rescue the patient with healthy bone marrow from a sibling, or in some instances, from a random donor from the general population. This is the process of bone marrow transplantation, and it involves the therapeutic transfer of healthy blood stem cells from the donor to replace the diseased blood stem cells of the child.
Approximately 300 cases of various autoimmune disease have been transplanted worldwide. In our country, the technique has been possible instituted with transplant experienced autologists performed by the transplant group from Kennedy Clinic. The complications that appear linked to the treatment are generally well managed. An advantage in patient support allows to maintain morbidity and mortality related to under-treatment, which make it more permissive the indication of this procedure.
Bone marrow is a spongy tissue found in your bones. Inside the marrow of the pelvic bone, hips, ribs, skull, and spine are tiny spaces that contain stem cells. These primitive cells are able to grow into various types of blood cells, including white blood cells called leukocytes, which fight infection, red blood cells or erythrocytes, which carry oxygen, and platelets, which enable the blood to clot and prevent excessive bleeding. White blood cells play an essential role in your immune system. Although there are 5 types of white blood cells, the 2 your bone marrow transplant team will mainly focus on are neutrophils, which account for about 60% of all white blood cells that move through your body, and lymphocytes that account for about 30%. Neutrophils play an essential role in keeping you healthy as they fight infection by surrounding and destroying foreign materials in your body. The absolute neutrophil count, or ANC, is very important, as it shows the percentage of neutrophils in your total white blood count. An acceptable ANC is above 1,000. If your count is less than 1,000, there is an increased risk for infection to develop. Depending on the type of chemotherapy and/or radiation your physician prescribes, your absolute neutrophil count can drop to a range between 500 to 0 for several days and/or weeks after your transplant. The transplant team will be closely watching your absolute neutrophil count throughout the transplant process. During this time, you may receive medication to help fight infection. Lymphocytes are another type of white blood cells that help you fight infections. Their numbers may remain low for months to years after transplant. Your doctor will be monitoring different types of lymphocytes and will tell you if there is a problem or concern. Lymphocytes and monocytes are other types of immune cells. Red blood cells carry oxygen from the lungs to the rest of the body on a molecule called hemoglobin. A normal hemoglobin level is 12.0 to 14.0 for females and 14.0 to 16.0 for males. When your hemoglobin level is normal, you have enough energy to function daily. During the transplant, your hemoglobin levels will be watched daily, as it is not uncommon for you to have a decrease in energy and look pale. If you develop a low hemoglobin count, known as anemia, the treatment is a blood transfusion. Platelets are needed for clotting your blood, which prevents unnecessary bleeding and bruising. A normal platelet count is 150,000 to 450,000. When your platelet count is low, your risk of bleeding is high. Your platelets will be closely monitored to assess your risk of bleeding and to determine if a platelet transfusion is needed. White cells, red cells, and platelets each have different lifespans, so the need for transfusions may vary.
Conclusion. Higher diversity of intestinal microbiota at the time of neutrophil engagement was associated with lower mortality, founded by the National Cancer Institute and others.
Hi, my name is Sanjay Kaushal. I'm in the Department of Cardiac Surgery at the University of Maryland School of Medicine. Today, we would like to share with you our results in a recent animal study demonstrating that when stem cells are injected in the heart, they're able to recover the heart by the secretion of their exosomes. And these exosomes, when detected in the plasma, can be a liquid biopsy of those cells when they're injected. So let us begin by looking more at a mechanistic level what our findings show. Here in this cartoon, we're showing that the stem cells are able to secrete independently secreted proteins or exosomes. These secreted proteins are able to interact with their receptor, which changes the state of the affected cell. The exosomes are microvesicles. They contain the signature of the cell that they're derived from. They contain proteins as well as microRNAs. These exosomes are secreted into the milieu of the organ that they're injected in. These exosomes are taken up by a cell And these exosomes are then broken up within the cell, and these microRNAs and secreted proteins are able to affect that cell. In this way, these stem cells are able to remodel or regenerate the organ of their choice. Human clinical studies will demonstrate the effectiveness of this liquid biopsy as a tool to determine whether the transplanted cells are able to regenerate their targeted organ.
Thanks.